Hi guys, in this video we're going to go through a couple of the jaw muscles that give people trigger points which leads to headaches. Now this is Dr. Jasper from MuscleWizard.net. What we're going to go through is two muscles that a lot of people overlook because we're always looking at the neck or the shoulder area or the front of the neck for headaches that are caused from trigger points. One of the things people overlook is the jaw. Now there's two muscles, and one is called the digastric. And there's a muscle in the front called a sternocleidomastoid. And we end up treating that muscle, and all of a sudden the headaches are kind of still there. So a lot of people start to think, wait a minute, that sternocleidomastoid may still have a lot of the trigger points, but it's actually a small muscle. It's called the digastric. And the way to get to it is, let me show you how to get to that sternocleidomastoid, and the digastric is just a little bit to the front of it. So if I turn my head, and I'm just going to put a little bit of pressure resistance, you're going to see this muscle pop up. There it is. And what happens is the sternocleidomastoid attaches all the way down here to here, and it goes all the way to back here called the mastoid bone. Now the digastric muscle, if you look at the angle of the jawbone right here, right at that angle and right here, it's somewhere in the middle, right about there. And you're just going to poke around and try to find it. And the big thing you want to see here is this recreating your headaches? And a lot of times this muscle is going to give you headaches going into the back of the head. And just press into that for a few seconds and see if the muscle relaxes, see if the headaches start improving. If it does, you've hit the right spot. So that at the end of the day is the digastric muscle. Is really easy to get. It's just in front of that sternocleidomastoid. Press around into that area, see if it is something that's going to give you that recreation of your headaches. If it is, apply some pressure there. Now the second muscle is called the masseter muscle, and the masseter muscle is the one that we clench down with our jaws. So it's one of the strongest muscles in our body actually, and it attaches right from the cheekbone at the top, and at that cheekbone it goes all the way down to here, right where your jawbone is. So from the cheekbone to the jawbone, you want to start bringing that finger down. And one of the ways to get it is just clench your teeth. If you clench your teeth, it's going to pop up into your hand. So as soon as you clench your teeth, it's going to pop up, and now you know you're on the right spot. The big thing about the masseter muscle is keep your jaw open just slightly as you're pressing into it. So as I find that spot, it's a bit tender down here. This one usually gives the headaches going up to the head. And if you find it, just press into it very gently. Don't overdo it on this muscle, or you're going to be very sore the next day. Again, as soon as you find the spot, you may want to actually kind of massage around it also. Also, you want to go a little bit behind, a little bit in the front. And also, even though the muscle up here, just under that cheekbone, is not, it doesn't usually give headaches, I want you to press that one also. You get a lot of pain relief from this area too. So right under the cheekbone, right about back here, going all the way down to where the jaw is. Again, the best way to find it is clench your teeth, and it's going to pop up. So as soon as I clench my teeth, I was a little bit too far ahead, so it's a little bit back here, right there for me. So it's right there. So at the end of the day, those are the two muscles that you want to look at when you've got headaches and the headaches are not getting better. It can come from the jaw. It can come from right into the back of the jaw, a digastric muscle and the masseter. And try that and see if that's going to help out. And for any other muscles, you can go to wizardofhealth.net, and we've got a wide variety of different videos and blog articles basically upon all the headaches and trigger points and all the different things you can do to prevent it and all the treatments you can do to make sure you get out of that pain relief. We'll talk to you guys in another video. Thanks.